Yesterday, the Greater West Bloomfield Chamber of Commerce held a Women's Inspiration Network event to talk about eating disorders and the toll that it takes on one's physical and mental health. Joining us now is Dr. Marcy Forta, who talked with the WIN event. Marcy, thanks so much for joining us this morning.
My pleasure. Thanks for asking.
Marcy, could you first tell us a little bit about yourself and your background and how you got involved with the Jewish Family Services that asked you to talk at the event yesterday?
Sure. So my background is actually in business. I ran actually a women and children's girls clothing store for many years with my sister-in-law, and I really watched how women and girls struggled with their bodies. Young girls, young women, and women who had children, always apologizing about their bodies, mothers struggling with their daughters, how to dress them, how to feel comfortable in their bodies. And that really resonated with me and bothered me. When I sold the store, I really wanted to help, so I decided to go back to school so that I would be equipped to kind of help head off what I was seeing with these body image issues. And so I went back and did my dissertation on risk factors for eating disorders, specifically in the Jewish community, but I learned so many things about all the common struggles and battles that we have. And Jewish Family Services does a lot of things in the community, but they are also working to help head off eating disorders. And so I've been partnering with them in their eating disorder arm to do some speaking engagements and some education. And they asked me to, speak yesterday. So that was a great opportunity.
Marcy, with the topic of eating disorders and disordered eating, it can be a really tough topic for many women to talk about. Can you share a little bit about what you spoke about at the WIN event yesterday?
Sure. So we talked first about the high-level statistics. Between 9 and 12% of all people in the United States will be diagnosed with an eating disorder. That 26% of people with an eating disorder attempt suicide. It's the second leading cause of death behind drug overdoses for adolescents. That they're diagnosed as young as 5 and up to 80 years of age. And really, that 70% of adolescent females and 45% of adolescent males don't like their bodies. So we talk a little bit about that. We clarified disordered eating versus what an eating disorder is. We talked about the struggle, what someone with an eating disorder is kind of struggling with and going through, risk factors of eating disorders, signs and symptoms of them, and then what we can do to help our children, support them through adolescence and this tough stage. And of course, we talked a little about prevention, how we can head off these devastating illnesses.
Marcy, before we go into your advice for people struggling with these problems, could you first just tell us the difference between eating disorders and disordered eating?
Sure. So disordered eating is kind of a broad term. It's more like disturbed eating practices that someone might have. They're not really severe enough to warrant diagnosis. Maybe they have some food rules. Maybe they don't eat at certain times of the day. Maybe they drink water, a certain amount of water before they eat, or chew their food a certain amount of times, or just kind of have a difficult relationship with food and their body image. Whereas an eating disorder is really a diagnosable illness where the person is experiencing some really severe disturbances in their eating behaviors, and it really even all the related thoughts and emotions that go along with that. So it's a much more severe level of disturbance.
And Marcy, do you have any advice either that you share with people that you talk about if someone is struggling with disordered eating or also those diagnosed eating disorders?
Right. I mean, that's really difficult. I think it's really important, especially for mothers, to educate themselves on appearance ideals, appearance bias, diet culture, the dangers of social media. That's really important. Learn about intuitive eating and health at every size. These are really, really helpful things. It's also so important to realize that bodies come in different shapes and sizes. We're all not meant to look alike. We have different genetics. We have different things going on. And we are not meant to be the same. Just like our personalities are not the same, our talents, our abilities are not the same. We're not meant to look the same. It's so important to have your daughter value herself beyond her physical body and looks. So I guess it's really about education, noticing the signs and symptoms, getting help first right away. It's really important to get help if you suspect an issue for your daughter, or your daughter suspects an issue for one of her friends. Go to the school social worker, go to your pediatrician right away. The earlier that you get treatment for an eating disorder, the more successful that treatment will be.
And Marcy, you touched on those signs and symptoms for eating disorders. Can you tell us a little bit about what parents and mothers should look out for if they assume or may think that their daughter is having either struggles with disordered eating or might have an eating disorder?
Sure. Eating disorders really can affect all organs and systems of your body. So you have to kind of there are a lot of different signs and symptoms of them, and they have to be put in context with one another because there are kind of behavioral symptoms. They might be more withdrawn. They don't want to be as social anymore, or mood swings, extreme mood swings. There's a lot of physical symptoms. Maybe they're nauseous or dizzy, or they start going to the bathroom more often, or have had extreme exercise. They might have abnormal lab findings. And developmentally, there are issues struggling in school, no longer being able to focus, pay attention for long periods of time. Weight fluctuation, if they have an extreme weight fluctuation, either a gain or a loss, that can also be a sign or a symptom. And gastrointestinally, they might have bloating, nausea, vomiting. It might be difficult for them to eat. They might also lose their period if they're a girl, or their period starts to come less often. So there are a lot of different areas of signs and symptoms that can affect all parts of your body.
And Marcy, if someone is maybe thinking that someone is struggling with these issues, what is your advice for either a parent or a friend talking to someone that they love that is struggling with these issues?
So, it's really difficult to talk to someone who's going through an eating disorder because they're struggling with kind of an eating disorder voice in their head and their own personality. So if you are suspecting that someone has an issue, you really need to go to a professional. Oftentimes they require teams of people to help treat an eating disorder. You need your physical doctor, there are mental health professionals, dietitians, nutritionists. It's really a team of people that help. So the best thing to do is try to get them to a doctor as soon as possible. If you suspect that they're going down that rabbit hole, or they might have some other issues that you could deal with that are outside of an eating disorder, then you can talk to them more easily. It'll be a conversation that you can have. But once you already suspect that they're possibly in an eating disorder place, you really need to go to a professional, right away. I would make sure, though, that you keep the lines of communication open with your daughters, with all your children, really, so that they know that they can talk to you about anything. You could also highlight the signs and symptoms that go on with an eating disorder, and also talk to them about their...
Oh, looks like we're having a little bit of Zoom issues. Well, we were talking with Dr. Marcy Forta. She talked at the WIN event yesterday about eating disorders and disordered eating. We've discussed thus far that we were talking about some signs and symptoms if one was possibly struggling with eating disorders and disordered eating, as well as what you can do if you think that somebody is struggling with those things.